Well, a number of women, especially premenopausal, have their gynecologist or primary care physician supply them with oral estrogen agents and some estrogen creams and progesterone creams, and include testosterone. And it's important for people to have their levels checked. For example, we hear polycystic ovarian syndrome. A lot of times with those individuals I see have a high testosterone level, and often it seems like they have a low progesterone level. And even people without that syndrome, when I do hormone testing, which would test your two different estrogens, we call it estrone or E1 and estradiol E2, and then your progesterone, and then your testosterone level. And a lot of women don't know they normally make testosterone, and they don't know about the different types of estrogens and which ones we need to follow. There's an estriol, which is an E3 that's really doesn't have any cancer affecting side effects, and actually is used to fight against cancer. So it's important for us to educate our patients along those needs. A lot of times when people are postmenopausal, we see people or doctors not replacing their estrogen, their progesterone, or their testosterone. They consider this is just a part of the aging process. But in anti-aging medicine, and I think also normal, I don't want to prematurely age or lose my sex drive, my libido, because I'm over 50. For example, low estrogen, you have vaginal thinning, vaginal dryness in women. A lot of times there's hot flashes involved. In progesterone, low progesterone, we see people and women with high anxiety. They don't sleep at night. They can have irritability. The same with testosterone. On too high of a testosterone that we see in polycystic ovarian syndrome a number of times is women can't sleep, they're irritable, they're angry, they're moody. They may have some increased hair on their body. Their skin may have some problems to it. And there are things that we can do to help lower a woman's testosterone that makes them feel dramatically better. With estrogen, learning how to give the appropriate amount of estrogen, which a lot of times I like to do bioidentical estrogens or creams in postmenopausal women, and usually, defer to their obstetrician gynecologist, and if they want to make changes, and to run my recommendations by their doctors. But I think the bioidentical estrogen and progesterones make sense to me. If you give estrogen, typically you want to add some progesterone because that can lower your progesterone. In people that have low progesterone, a lot of times we want to give some estrogen also. But that helps the vaginal lining, it helps the dryness, it helps to help them with their sexual relations much better. A lot of women have low testosterone also, and you've heard of oral agents like Estratest that has some estrogen and testosterone in it. And there's things that we can do. There's testosterone creams that you can use, and usually rotate sites, but you can use them intravaginally or at different sites on the hip or the body that are used, and that can increase a lady's libido and sex drive. And again, these often occur postmenopausal, but women at 50 still deserve to have appropriate sex drive and sex relations and a healthy body. Also, estrogen is huge in protecting memory or the brain for women, and it's also really a major force in having and preventing osteoporosis. So estrogen and progesterone are things that we need to follow and lead to keep in balance is what I'm trying to balance our hormones for where we are in life.